Guide to the graphic. Here we have depicted the left ventricle. With the mitral valve that controls blood flow from the left atrium to the left ventricle. In blue-green is the left ventricular septum. The multicolored lines are the papillary muscles. And here we have the left ventricular wall. Mitral stenosis, an abnormal narrowing of the mitral valve orifice. Mitral stenosis, due predominantly to rheumatic heart disease, is usually identified before old age and accounts for about 1/3 of mitral valve disease in the elderly. Its severity is usually such that an adequate response to medical therapy was obtained. However, this incidence may decrease because of the reduced incidence of rheumatic fever in developed countries. Commissural fusion and fibrosis occur, as does calcification of the leaflets and chordae. Some degree of mitral regurgitation often coexists. Less often, progressive extension of mitral annular calcification causes moderately severe mitral stenosis. 1/3 of patients older than 70 years have calcium deposition in the aortic or mitral valve. Symptoms, signs, and diagnosis. The clinical features are comparable to those in younger persons and include a loud first heart sound, an apical diastolic rumble with pre-systolic accentuation, and an opening snap. The latter may soften or disappear with valvular calcification, and the diastolic murmur may become softer. A right ventricular parasternal impulse is often palpable, and venous pressure may be elevated. Atrial fibrillation is more common in elderly patients, as is complicating arterial embolism. Left atrial enlargement is often seen on chest X-ray. Electrocardiographic evidence of right ventricular hypertrophy is uncommon. Echocardiography with Doppler flow studies can document mitral stenosis and help estimate its severity. Left atrial myxoma may mimic mitral stenosis and can be differentiated by echocardiography. And that's mitral stenosis.